We are live. I'm excited. Today is Wednesday. We've got a great topic to share with everybody. Always love to talk about the gut, and it's all about your health when we talk about the gut. Having said that, right there, high salt, it impacts the health of the gut microbiome. Now, just so you know, the average American has a high salt diet. They eat a lot of canned foods, unfortunately, or we eat a lot of canned foods. People add salt to a lot of different things. The American Heart Association recommends 2,300 milligrams or less. The average American consumes 3,400 milligrams, which is almost obviously 50% more than they should. But I was looking at this article that just came out from the University of Georgia Medical School, and it without question caught my eye. So let's go through what it spoke about. Let's go look at the implications. And again, everybody have to understand that the epicenter of your health is your gut. Do you have the guts to be healthy? What have you done for your guts lately? This study really showed particularly females benefited who had untreated hypertension. They received a reduction in salt intake, which led to an improved gut microbiome for the women, men and women, but women especially, and they had a vertiginous decrease in blood pressure. The study had about 145 adults with untreated hypertension. So now they're talking about hypertension being 120 over 80 and more. We've lowered the idea of hypertension. However, these people in the study, they were looking at 140 over 90. Those 145 adults with untreated hypertension, they were consuming less than 2,300 milligrams, in that they were actually at 2,000 milligrams. It resulted, surprisingly, happily, if you will, the result was an increase in what we call short-chain fatty acids. Short-chain fatty acids, I've got a great definition for short-chain fatty acids right over here. I'm going to actually put it in the link. I want everybody to know what a short-chain fatty acid is. They are a major energy source for epithelial cells lining the colon, which keep the contents from leaking out of the GI tract into the body. So short-chain fatty acids have a lot of positive properties. One of the biggest properties is they allow or don't allow for the increase in what we call leaky gut. Short-chain fatty acids are also thought to play a role in protecting us from common problems like inflammation, obesity, and diabetes. Now, they're able to do so because they keep the gut environment in a very statuesque status. In addition, they don't allow for that leaky gut. There's a tremendous amount of literature that speaks to the idea of leaky gut, leading you down a path of increased blood sugar issues, diabetes, increased body composition, musculoskeletal injuries, autoimmunity, overload to the liver, increase in heart. Basically, as we always say, the gut is the epicenter. Now, the short-chain fatty acids are critical elements. They are what we call postbiotics. So we're supposed to keep our gut in good condition, take some probiotics pro-life. You could do that mostly with food, but I would definitely recommend supplementing to get the probiotics. You also give the probiotics a prebiotic. Prebiotics like garlic leeks, artichokes, Jerusalem artichokes, any fermented foods feed the probiotics, and what they leave, like short-chain fatty acids, they're residual. That's a postbiotic, and that postbiotic is going to determine all these health properties, which you're seeing now with the decrease in blood pressure. What's the number one reason that people over 65 went to the hospital because of COVID-19? Hypertension. What's the number one reason that people went to the hospital in general? Hypertension. Number two, obesity. All can be attributed to gut health. May reminded me that I missed a couple of prebiotics. They're kimchi and sauerkraut. Again, those fermented food. Love my kimchi. So let's get back to this. Short-chain fatty acids. I want to really speak about them because, you know, it's not discussed enough on these Facebook Lives and these podcasts. It's sort of like amongst the functional medicine docs and everybody, we talk about it, but we don't share it with the patients. Short-chain fatty acids play a major role in what we call blood pressure regulation. Additionally, they're small metabolites. They get absorbed in the circulation. They bind to specific receptors, the receptors of lining in blood vessels and the kidneys. So they are able to do that. They actually affect the ACE2 receptor sites. And we all know about those ACE2 receptor sites. They're critical elements to overall functioning of the kidney, and it also allows specific viruses with spike proteins to get in. Short-chain fatty acids also allow and regulate the release of renin. Renin will determine how high your blood pressure will go. So they are communicating and not allowing an excessive amount of renin to be released. So these short-chain fatty acids, you can produce them and or you can take like L-butyrate. So let me give you a couple of short-chain fatty acids. Acetate, propionate, and butyrate. Butyrate being the gold medal winner. So we always want to be able to provide a lot of butyrate. The study, which was interesting in that it had a 2-week study where they gave all the participants, both men and women, 2,000 milligrams daily. It's called a randomized, controlled, placebo-controlled study, in that half of the people got a sodium tablet or placebo tablet. Nobody knew what they got. The sodium tablet was 9 times, or placebo tablet was 9 times daily for 6 weeks. They then switched the group. So nobody knew what they had. The findings, which were very interesting, in that sodium reduction, whoever's sodium reduced, found that they all had an increase of 8 different short-chain fatty acids. We, in the functional medicine world, only talk about 3. The short-chain fatty acid levels that were increased were associated with a decrease in blood pressure and an increase in blood vessel flexibility. So the blood vessels don't get stiff. That stiffness, where it's stickiness and it doesn't move, really leads you down a deleterious path. So blood vessel flexibility is something that we always associate with youthfulness. Now we also saw an increase in salt intake affected the males and the women equally. So when you increased it, both men and women, there was no gender differences. However, the decrease, when you decrease salt intake, it affected women much more, in that they almost dropped their blood pressure twice as compared to men. So the takeaway here is men and women on the upside were affected equally. Women, for whatever reason, seem to have short-chain fatty acids have a more positive effect. So again, that was the Medical College of Georgia at Augusta University. That just came out on June 10th, 2020, obviously. So again, we're trying to keep these Facebook Lives really quick. Hey, Yolanda, you're more than welcome. I really appreciate you listening. We're trying to help everybody. I've noticed a lot of people pass these on. Afterwards, we're all back at work. If you have any topics you want me to cover, feel free. Always got my big shout outs to all my Creator Chiropractic and my 8 Weeks to Wellness. Of course, Nutridyne and the like. We are just, as I said, trying to keep it under a certain amount of time. So just remember, every Monday to Friday, I'm still going, even though I'm clearly back in the office, post-COVID, during COVID, whatever you want to call it. We're trying to make it every day at 1 o'clock to 1:30, Monday through Friday. So if there's anything you need, please let us know. Like us, comment, share us. Look at some of our other social. Everything is Dr. Robert Silverman. Hope to hear from you soon. Thank you for your few minutes today. Dr. Rob, always yours in health.